further ado, thank you for participating in our question. We're going to get started. I just want to do a couple of housekeeping items before I introduce Dr. Russ. You are attending the trauma and PTSD session, as you can tell from the screen. We wanted to thank our sponsors for their support of Symposium. And also to say, if you have questions, there will be time for questions at the end. If you could please put them into the Q&A. If you're streaming on Facebook Live, you can relay those questions in the chat and they'll be relayed to us. Magic. And also, if you're having any kind of tech issues, you can put that into the chat and we'll be sure to have someone help you out with that. So I'm very excited to have Dr. Russ speak with us this afternoon or this evening, depending on where you are, on trauma and PTSD. And without further ado, I will stop sharing my screen and give it over to him. So thank you so much.
So again, thanks for having me today. I wanted to start with just an acknowledgement of thanking you all for inviting me into your space. I'm not someone with a bleeding disorder, and in reading up on the history and current experience of those of you with whom I'm speaking now, I see the stress and strain your community's been under for a long time. I also see the intersections with pieces of the healthcare world coming from a mental health place that I understand well. Issues of health equity, intersecting identities, social determinants of health, navigating the challenges of health insurance, and fighting for parity. I wanted to say this because I come into these issues from a mental health perspective, and I know the people and organizations fighting on that side of the hill and working from that perspective. And I'm going to talk a lot today about what you can do as individuals and small groups to help you cope with the stress and trauma in your life. But I want you to hear that I understand these are not individual issues. Seeing the work and advocacy the bleeding disorder community is doing reminds me how many of us are in this fight for systemic change. And that gives me some hope that all of that work will make the world and our healthcare system a better place and more accommodating for those down the road. Advocacy and learning is work, and this is a point you'll hear me come back to, but it can also be a kind of self-care and collective care. Meetings with your elected officials, meetings with leadership in medical facilities, medical staff, conversations with people in insurance companies, those are all important. That work creates meaning and is connected hopefully to the values that are important to you. So especially when you're doing that with other people, when you're coming to events like this talk today and the rest of the conference that you're participating in, give yourself some credit for doing that and really acknowledge how important that work is and that community is. We're all pulled in a million different directions these days. So putting aside this hour to be with me is something that I really appreciate. So what am I going to try to do here today? I have 4 objectives that we'll try to get through. I want to talk a bit about stress, anxiety, PTSD. What are those things? How do you understand those things in the context of chronic illness, in the context of the COVID and racism pandemics that we're in the middle of? I want to talk a bunch about coping, how you can develop your own coping toolkits, and we'll talk about a coping backpack and creating that, and the importance of social connection. One of the things that gets lost when we talk about self-care or mindfulness or other things that are really, really helpful is making sure that we're taking care of our communities and taking care of each other. And then at the end, I'll include some resources on how to access mental health care if that's what you need. That's a big challenge for lots of folks, and I think we've got some helpful resources to do that. All right, so if you wouldn't mind just putting something in the chat for me. It's a little hard to get to know who I'm talking to in a virtual environment. This is my first time speaking with this group, so I'd like to know what led you to attend the webinar. So if you can just put that in the chat, any comments you have either now or ongoing. I'll save some time for questions at the end. But if there are things you want me to answer or things that I'm not picking up on as we talk, please let me know in the chat. Learn about resources, great. I appreciate that. Thanks, Angela. We'll definitely get to that towards the end. Great. How do we help? Our community members experience a lot of trauma, and I want to help. Yeah, I appreciate that, and we'll get to that. Mental health. Your son has severe hemophilia B, mom of kiddos, lots of traumatic medical procedures. Absolutely. Great. I'm going to keep an eye on the chat as I head to our next slide. Long-term health issues. Perfect. Chronic illness and PTSD, how to help, information. That's great. I'm going to try to get to most of that. I think the stuff I have in here is pretty well tailored to those questions, but if we don't hit those at the end, please ask. The first thing I like to do when we talk about stress and kind of the continuum of stress and stress disorders is to define that term. It's something we talk about a lot. Everyone is stressed these days. But how do we really think about that? So a pretty kind of basic definition of stress is it occurs when demands, whatever those demands are, could be medical conditions, health conditions, could be things like school or work or family, exceed your resources, whatever those resources are. Time, there's only so many hours in a day, financial resources, psychological resources, and that's the piece that we'll focus on here, is how we can work to improve your psychological resources. It's important to remember as we get into kind of the problems of stress that our stress system in our body is adaptive. It's designed to help us. Stress involves basically just bodily arousal, right? We feel some challenge coming on, our body surges with adrenaline and other things, our heart starts pumping, emotions flow, and our body gets ready to do something. That's our fight, flight, or freeze response. And those physical symptoms can change, how we interpret them can change with your emotional reaction. So you think about sometimes when we're really stressed, we feel really angry or really excited if we're about to take on a big event. Sometimes we forget that positive events can feel stressful as well. You can think about weddings or celebrations or those sorts of things. Stress can help us stay motivated and stay focused. It gets our bodies ready for action, ready to do something. The challenges with stress come when it moves from that acute place to a chronic place. So if you have some short-term issue that you need to get over, get through, a single medical procedure, for example, or a race or a big presentation for your job, something like that, that acute stress can be helpful in helping you move through that. But when stress starts to become chronic and long-term, and those demands outweigh your resources over long periods of time, that's where you start to feel despair, helplessness, to really feel the struggle of, when we talk about feeling stress, that's usually what we're talking about, is that chronic stress. Now, lots of kinds of things impact that experience of chronic stress. So it can be the external things happening in our life, and it can be the chronic conditions that we're dealing with, things like poverty, racism, family dysfunction, early life distress, traumatic early childhood kinds of experiences. And then specifically, when we think about the bleeding disorders community, the chronic stress of repeated medical procedures, the frequent infusions, particularly with kids, I think about potential fear responses to medical equipment and medical procedures, and the anxiety of doing that over and over again. When you're dealing with chronic health conditions, financial stress, dealing with insurance, and the financial stress of appointments and managing appointments, and how do you develop a work schedule and a calendar to meet everybody, all of that stuff builds up. And that's added on to issues around access to care, both for bleeding disorders, for mental health care, for any kind of medical care in the fragmented system that we have in this country. And then the impact, particularly for your community, about HIV and the trauma that comes with that experience. That's really a collective trauma that your community experienced. So if you think about those two things together, chronic medical conditions, challenges with healthcare, the pandemics we're under now, COVID-19, this increased awareness and attention to racism and police violence that we've experienced, all of that creates conditions where there's a lot of chronic stress happening even above and beyond what you might have been experiencing a couple of years ago. So one thing I'll say now is that chronic stress doesn't necessarily mean PTSD. I'll talk a little bit in a minute about what PTSD means. It can show up as anxiety, depression, substance use. Stress is a really individual experience that looks different in different people. And we'll talk a bit about kind of common ways that stress develops and looks. The important thing is that when you are under that much chronic stress, you have to figure out how to operate differently. If we don't start figuring out how to operate differently, you stop being able to function. That's where the sort of impairment develops. So think about impacting your ability to live, to love, to work. It affects our relationships with people we're close to. And when we think about increasing our resources or helping that stress, we can't most of the time increase our money very easily, our financial resources. It's hard to increase time. There's only so many hours in a day, and we can't expand beyond 24 hours in a day. So we need to figure out how to either decrease demands or increase those psychological resources. But before we figure out what to change, we first need to learn how to track what's happening to us. So you need to be paying attention to how you know when your stress level is increasing, how you know something needs to change. So again, if you want to just put in the chat, sort of if you think about your own lives, how do you know when your stress level is increasing? What sort of things do you notice? Do people around you notice? Where maybe you think, hey, I need a change. One of the things that's happened with me over the pandemic is about every 3 or 4 months, I've needed to sort of reset what my coping strategies are. Irritable. Thanks, Matthew. That's a great one. A lot of us see that irritation, and I'll tell you, my partner is the one who will notice that in me. It won't always be you who notices. The people around you will notice that irritability for sure. And when you need to kind of reset, you might notice different kinds of emotional reactions. Poor sleep, that's a big one. Quietness. So I put up here some different emotions that people experience. Anger is definitely on there. We tend to think of stress as sort of an anxious thing. We're feeling stressed and maybe sort of jittery. Overwhelmed, yeah, that numbness is absolutely there. Sometimes we just feel sort of shut down. Our bodies can't manage anymore, and you just feel sort of out of sorts, or like you can't even feel anymore. Sometimes it's sadness or grief at where the world is or what you're managing. Sometimes it is that kind of jitteriness or acute even panic, where it feels like your mind's just going too fast to get a hold of anything. Stress often increases bleeding episodes. That's absolutely. So when I look at how you self-monitor for common signs of distress, worsening of chronic health problems. So one of the ways that stress impacts the body is increasing inflammation, and we're increasing our understanding of how all that works biologically. But we know obviously the mind and body are linked really closely, and stress tends to worsen whatever physical health conditions that you're managing. It also can create new physical reactions, things like headaches, pain, stomach problems, rashes, all of these sorts of things, mostly through this inflammatory pathway. You can also see changes in appetite, energy level, activity. Sometimes we go sort of in a more sped up or kind of frantic place where we're trying to do lots and lots of stuff. And sometimes it looks like you're sort of shut down. Again, people have different responses. So part of what's important is thinking about what those signs are for you that may be different than your partner or your best friend or other people who you're close with. Again, things like irritability, increased substance use, those are things that tend to get picked up on by other people. So as you're thinking about monitoring your stress level and kind of where your stress level's at, think about checking in with important people in your life, people you're close with, and invite them in to check in with you. If you notice something about my behavior change, can you tell me? Can you let me know? Open those conversations with important others. Then you want to start thinking about, okay, if these things are happening, that's when you need to start thinking about, I need to do something about that. And we'll talk a little bit about what you can do personally, but you want to also be thinking about, is this a crisis I'm in? Do I need to really engage outside help? Maybe that's call in friends or family, call a crisis line, reach out for additional support, all of those sorts of things. Or do you need some additional treatment? Do you need telehealth for therapy, for medication? Part of what you're looking for is paying attention to when these things, again, are interfering with your ability to function and enjoy life. Most of these things we can manage in some amount of moderation for a few days. Again, if you have a particularly difficult period in your life, sometimes a few weeks. When it starts to be a month, couple of months, that's when these things start to build up and start to really affect our ability to function. And it's a sign that you need to address those in some way. So be paying attention to that and think about times when you can check in with yourself and check in with others about how you're doing and about what you need and are you getting enough. So I want to say a little bit about PTSD. Just looking through the chat, it sounds like several folks have been diagnosed or have folks close to them who've been diagnosed with PTSD. One thing I'll say just generally about stress disorders and kind of mental health diagnoses in general is that these are all of the mental health diagnoses are fairly narrow categories of stress disorders. So PTSD is a particular kind of stress response, but you can have clinically significant levels of stress that may or may not be PTSD. So it may look like anxiety, may look like depression, substance use disorders, drinking more than you need to or using other substances, or something else entirely. It's important to recognize that for the most part, these disorders are treatable and that there's help available. We know a lot more even than we did 10 or 15 years ago about how to treat stress disorders. Now, it's not perfect. Not everyone is going to come into treatment and everything's going to be better immediately. It takes some time, it takes some work, but most folks who go into treatment can see pretty substantial improvement in their symptoms over the course of 4 to 6 months, sometimes a year, depending on kind of what that looks like. So I'd encourage you to seek out treatment if you haven't done so. And again, there's some resources at the end of this slide deck that will help with that. But a little bit just so you understand kind of what PTSD is. So when we think about post-trauma, so there has to be some traumatic event, some major, typically kind of life-threatening experience that you're then having intrusive symptoms about. And this is really just thinking about it all the time and having difficulty controlling your thoughts around the event. The key thing with PTSD or other kind of fear and anxiety-based disorders is this idea of avoidance. That we tend to avoid thinking about things that make us uncomfortable or that create some distress in ourselves. And that avoidance can actually make the distress and anxiety worse. The other pieces of PTSD are this negative alterations in cognition and mood. This is kind of the depressive piece of PTSD, that ongoing emotional negativity, the inability to feel good about yourself or the world or feel safe, those sorts of things. And then what we think of as hyperarousal and increased reactivity. The classic example of this is the combat veteran who hears a car backfire and takes cover because it reminds them of a gunshot, that sort of jumpiness or on edgeness that folks have. So that's a little bit about just how to think about the continuum of stress and experiences of stress and stress disorders. So what do we do about that? What kind of coping tools and treatment can help with these things? So when I asked you about stress, lots of folks had lots of pretty challenging emotions that they experienced. I'd like now, if you all can, to put some things in the chat about how you cope with stress. So you've put the challenges in the chat. So now I'd like you to put some of the things that you might do to cope in the chat. We're going to talk about in the next bit of the talk some things you can do as individuals, but that doesn't take away from the fact that these are systemic issues, and that a lot of the reason that you're feeling pain is that our healthcare system and other systems that interact on you are not giving you the tools and resources to cope. So I think it's important as we talk about what you can do as an individual to make a clear distinction that the reactions that you're having are the result in lots of cases of systemic failures and not things that you're doing wrong or failing to do. But there are some things that you can do as an individual and as a community to help make yourself feel better in the face of those systemic challenges. I'm seeing lots of great activities here. Go for a run, taking breaks, absolutely. Reading books, yoga, pet the cat, love it. Listening to music, clean and play the piano, ride my bike, walk. That's all great. Exercise is great if you're able to do it. And it doesn't have to be lots and lots of like intense, couple hours a day or anything. Moving your body is helpful for processing emotions. So a little bit of exercise can really help with your sleep, with your mood, with all kinds of things. So I don't like to bury the lead in my talk. So I try to make these 3 key coping tips up front. Talk about it, don't avoid, and make time for yourself. So the first thing is talk about it. One of the things that we tend to do in our lives is when we're stressed is to kind of withdraw or not talk to other people about it. We have this sense that if we share what we're struggling with, people might see us as a burden or not like that in somehow. And that's really backwards. That I think for the most part, if you think about your experiences where someone has come to you in a difficult spot or needed help or support with something, it feels good that they come to you. And we know this from research on self-disclosure and social support, that people for the most part enjoy feeling like there's someone you can come to and want to help. So you can think about people to talk about, so friends, family, if you need to, a psychologist or other mental health worker, employees, coworkers, folks in your life, your community, the bleeding disorders community, connect with other folks here. So you can think about all those kinds of things. Don't avoid. So this is another thing that we try to do, is sort of push off the most distressing things that we're trying to deal with. So we try not to think about these things and, oh, this is a really stressful thing, so I'm just going to kind of put it over here and not deal with it. It's important to balance actually some intentional time thinking about the things that are difficult in your life with time off, because you don't want to go the other direction and sort of spend all of your time thinking or ruminating about the most difficult pieces of your life. So thinking about difficult situations and balancing that with time off, and then again making time for yourself. And you're listing lots of great ways to do that here. Sleep, eating, exercise. If you do those things, it helps really take care of your body in a way that helps you think through the other things that you need to do. And these are not easy things. I don't want to say sleep, eating, exercise like, it's simple to have those things going well. But if you attend to those things and can even get some little improvement in those things, if you have a lot of trouble sleeping and maybe you're only sleeping 3-4 hours a night, if you can get that up to 5 hours a night, that'll make a really big difference. Even though that might not be quite enough for you, it tends to make a difference in your ability to think, to plan, to marshal your other resources to manage your life better. So again, meeting your basic needs, that eat, drink, sleep piece, really helps you do the other things you need to do to take care of yourself. So when you think about sustaining your well-being, again, maybe during periods of particularly bad stress, when things are feeling really overwhelming, you need to take breaks. sort of whenever possible, allow yourself to do things that are enjoyable, things you find comforting, fun, relaxing. Again, all the things that you're listing there, listening to music, reading books. Um, there's a tendency when you have a lot going on to feel guilty about taking that time for yourself, or I shouldn't be doing this, I've got a million things on my plate, or I need to be taking care of this person in my life who's suffering, or some other task that you need to be doing. And I think that's if you can think about it as taking care of yourself so that you can be more effective in doing things. You've probably heard this before, but it's the analogy that psychologists love. If you've been on a plane before and they tell you to put your oxygen mask on before you put it on your kids or other people, that's what we're talking about. You got to take care of yourself before you help others. So put your own oxygen mask on first. Um, Other kind of things to think about is creating some routines and schedules. And part of that is making sure you're scheduling in some social contact for yourself with people who are supportive, with people who you can communicate with constructively, who can communicate with you constructively, who you care about, who understand what you're going for. Again, I think connecting to other folks in the bleeding disorder community can be really helpful, to have people around you who really understand at a deep level what you're struggling with and can help you with that. One thing, especially these days, that folks do a lot of sort of doom scrolling in various ways, or being on social media all the time and checking in. And you really want to balance that, especially if it makes your mood go down. And again, you can kind of think about little experiments for yourself of, if I take a couple of days off of Twitter or Facebook, does that make me feel better or worse? That might be an important place to connect with people, and so there may be some value in that. But you also want to make sure that you're not just sort of scrolling through bad news all the time, or things that stress you out and add to that stress. Another thing that I think about when you're trying to sustain that well-being is building that meaning making in. Again, that piece that I talked about at the beginning of making sure you're thinking of the kind of advocacy work you do, the kind of education you do, your engagement with your associations. All of that work is part of self-care, and that's important. And it's important in helping get that support from your community. So one way I think about that is connecting the stress in your life to your values, and thinking about, um, things that are important to you, and making sure that even if you're feeling stressed by them, that they are connected to your values. And the first step to doing that is seeing and acknowledging your stress. So now you can type in the chat box an important value of yours, or just think about it. And then we're going to go through just briefly a little exercise here to help you maybe cope a little bit. Just a sort of short exercise that you can take with you. I like things that are around breathing and thinking, because they're things you can do in lots of places. So when you're in a waiting room at the doctor's office, when you're at home, a few minutes before bed. These sorts of things are a good time for short breathing exercise. Balance, I really like that as a value. So as we go through this exercise, it might be helpful to think of something that's stressing you out. And as we go through this, whenever you learn a new tool like this, it's important that you're not necessarily thinking about the worst thing in your life, but not the easiest thing in your life either. So if you think about one is like a very easy task, something that's not super stressful, and a 10 being like the most stressful, sort of a 4 or 5 on that 1 to 10 scale. And the first thing I want you to do is just start to notice your breath, and just breathe. Um, Breathing is with you wherever you are, but we don't pay attention to it all the time. And so if you're feeling particularly kind of panicky, or starting to feel out of control, or in a more stressful situation than you ever realized, just start noticing your breath. You don't have to do anything with it. You don't have to change it. just notice how you're breathing, notice your breaths in and out, and then start to spread that awareness from your breath to the rest of your body. And we're going to take a moment just to acknowledge that stress. And that's actually going to help the way that our brains process it. So when we recognize our stress and acknowledge that it's there, it helps move that thinking and the way our brain's working from that fear and emotion, the amygdala part of our brain, to our frontal cortex, our executive control, our planning parts of our brain. And then as you start to notice your stress, you can just notice your emotions. And again, you're just going to label them. You might be feeling um, anxiety, you might be feeling sadness, you might be feeling frustration. Whatever it is, just start to notice and really label that emotion. What is it that you're feeling? And if you're somebody who has trouble identifying your feelings, you can Google something another time called a feelings wheel. There's lots of examples of these that have just, or feelings lists that have lots of feelings words, and it can help you sort of get maybe a little more detail about how you're feeling. And then you're just gonna sit with that emotion for a few minutes. Um, Here we're just gonna do it briefly. Um, you might be noticing physical sensations, some tightness in your neck, shoulders. That's a lot of times we hold our shoulders up when we're feeling tense. But by paying attention to these stress and emotions and then connecting to values, balance, kindness, we can start to accept our stress and stay connected to those things that we really value. And one thing that might be helpful is even just to think about the sentence, I'm stressed about whatever their stressor is, and I deeply care about the, the value that you've thought about. So it's just hopefully a brief exercise that may help you add something to your kind of coping toolkit. I want to mention a little bit about sleep as we come out of that exercise. And if you're still feeling things from that exercise, just give yourself kind of a minute or so to notice whatever's there. Um, to talk about sleep, there's we talk about sleep hygiene, which is essentially ways to help you get better sleep at night. There are a couple of things on here that I'll talk about, and you can think about these other tips other times. So avoiding alcohol or caffeine, those are really, really bad for your sleep. And then putting your phone away. This is the one when I'm working with patients in my office that everyone kind of fights me on. A lot of us, me included, I'm working at night, responding to emails, that sort of thing. It's really important if you can put those screens away, half hour before you get in bed, read a book, but scrolling your phone at night, especially if you have sleep problems, can really prolong that. You're activating lots of things in your head that you want to hopefully dial down a bit. As you're thinking about these different things that I'm talking about and managing stress in your life, one thing that we often try to do is like, I'm feeling really overwhelmed, or you're feeling sort of shut down, and you try to like revamp everything in your life. I'm going to change my diet. I'm going to start exercising. I'm going to set, boundaries with people in my life. Trying to do all that at one time creates a big cognitive load and is really hard to manage. So you want to think about focusing on one thing at a time, one stressor at a time, one change at a time, and think like a scientist. As you're trying to develop strategies for managing your stress, change something, try an approach, see if it helps. All those things we talked about earlier about checking in on your stress level, where are your emotions, where are the behaviors that you're at, how are you feeling in your body? Are the things you're doing helping or not? If it's not helping, try something else. There's lots of things to try. Don't stick with something that's not working. And if it's working, it's important to give yourself that feedback that, hey, I'm doing something here that is really helpful for me. So I want you to think about a couple of coping mechanisms now that you can try. So you want to think about starting small, choosing a way of coping or something you want to try. Maybe it's something you've been thinking about. It might be reaching out to a friend you haven't talked to, sharing some amount of distress with somebody who's important in your life who you wouldn't normally share with, even trying just noticing your breath more often. Um, but think about some way of coping that maybe has worked for you in the past. Think about something that you have control over whenever you're trying to increase your coping. It's hard to say, I want my job to treat me better, or I wish the staff at the doctor's office I go to wouldn't be so rude. Those sorts of things, we don't have control over what other people do. So what can you change that might help you manage your stress better going forward? And just thinking about that as an active process that you have control over. One way to think about this is creating a coping backpack. We're not going to watch this video because we don't have time, but great. Thanks, Karen, put in the chat, yoga and focusing on one thing at a time. I love that. Is thinking about creating a coping backpack. And there's a psychologist, Ali Matu, who's got a YouTube video, and the link's there for you to watch. It's about a 15-minute long video to talk about what do you need to carry with you on a daily basis to help you get through your day. He's got a lot of other great videos. He's someone who I really trust his advice in terms of lots of problems. So you might want to just kind of click around his YouTube channel and watch some of those videos. I think it's really, really good stuff. Another coping mechanism, Martin put in the chat, trying not to overreact to others' problems. Absolutely. Yeah, and so you want to think about sort of what you can do to help yourself with that. And sometimes that might just be taking a few breaths before you respond, checking in about your emotions and trying to label them before you respond to another person. But I appreciate that transition into the last kind of coping piece we're going to talk about, which is relationships and community. One of the things that I think a lot about, and lots of people have talked about over the pandemic, is this social distancing message we've gotten during COVID that is really about physical distance and not social distance. But in lots of ways, our relationships have been disrupted. And prioritizing your relationships and your relational health can be a really valuable way to help yourself manage stress. So again, I want you to think about the community that you have here, other folks who are attending these workshops, who you're learning from, who you're talking to, people from the bleeding disorders community, your friends, family, folks at home, and reaching out to those who can support you and those who need support. Again, supporting other people can be a way of self-care. If you've got some resources or some energy, it doesn't have to be all the time, but sometimes helping other people can actually increase the amount of energy you have. Connecting them to resources that you found helpful can feel really gratifying and meaningful to us. And then reaching out to those important people and sharing some of the stuff that you are struggling with is critically important. So thinking about creating those connections, and particularly for those of you who might think about your relationships feeling disrupted over COVID or not connecting with folks, you might want to think about re-engaging with that. I know kind of for the first like 6-8 months of the pandemic, folks were doing lots of like Zoom meetings and video chats with people, even maybe like people from their past, from high school or college that they hadn't connected with in a while. And then that sort of faded off. And I think the sort of grind of all of that caught up with folks, and some of that's fallen off in a way that you might want to think about re-engaging with that. So again, in thinking about how you can kind of be practically helpful, think about 2 people you can connect with maybe in the next week to reach out to. And again, there may be people you're already in contact with, you're just not sharing important pieces of yourself with them. Or it may be people that you've lost touch with and you want to reach out to and say, hey, I went to this workshop and they told me to reach out to somebody, so I'm trying to reconnect and I wanted to see how you were doing and to talk a little bit about life. So I'll wrap up here with a couple of slides about how to know when you need more help. So when your coping skills aren't working, so we talked about a lot of stuff today about how to help, but that's not going to be enough all the time. The other place to kind of keep an eye on as you're tracking your own stress levels is when that unhealthy coping becomes more common. Again, when that irritability starts to really disrupt the people around you, when your anxiety feels like you're having trouble getting your work done, when your concentration isn't there, or even when you're thinking, I just haven't felt good in a long time, or I haven't even been able to connect with my emotions. Really, when your ability to love, work, or play is affected. And again, don't take it on yourself to monitor those things. Ask the important people in your life. They'll tell you, they're noticing. So they want to help. I have a couple of links on here. So the Kentucky Psychological Association, who I work for, developed a roadmap to behavioral health. It's a little bit focused on Kentucky, but it has a lot of questions on how to ask a therapist for what they're going to do, how to talk to your insurance company about therapy and therapists. Mental Health America, and it looked like there were a couple folks from MHA on, has a lot of great resources on finding helps and screeners and those sorts of things. So I encourage you to use those resources. Thinking about care for folks with bleeding disorders, you've got your hemophilia treatment centers, and I know you're checking in with them a lot of times yearly, but they've got social workers there, is my understanding, at least in most of them, who can help connect you with care. One of the things, if you've had issues connecting with care in the past, that is, I think, different now, is there's a lot more integrated care. So mental health clinicians embedded in your primary care offices, and then an explosion in telehealth services. So almost every mental health practitioner did at least some telehealth during the pandemic. So you can access folks across your state, and in some cases across state lines, depending on the professional regulations and arrangements by their associations. But there's a lot more access to care than there was before. The flip side is there's a lot more need. So it still may be a little bit hard to get in places, but I encourage you to check that out if you've had issues before. These are just, again, a couple more resources, places you can go. Your state psych associations, your state social work associations are great places to go. Some directories to find mental health care and different resources that you all can take a look at. So I also put my email address on there, and I've got that on my last slide. So you're welcome to reach out to me. I'm happy to get you connected. So I know we're at time here, so I will stop talking and work on taking some questions. So thank you all.
Thank you so much, Dr. Russ. That was a really fantastic presentation. And I really like how you drew the parallel and the intersection between, well, I guess it's not a parallel and an intersection between advocacy and engagement. So that was fantastic. And we do have a question in the chat. So if you do have questions, definitely put them into the Q&A or the chat. We have just a few minutes before we need to wrap up and get people to the next session. So the question is, how do you find a balance between being around people and talking and being alone so that you can sort through your emotions?
That's a really great question. I think one thing to recognize is that's not going to be the same for everyone. So a lot of times, particularly if you're in relationships or close relationships with people who operate really differently from you, they'll say, you just need more time to yourself, or you should talk to folks more. And it's really important, I think, to do some kind of self-examination about what it is that you need and what that balance looks like for you. So the kind of classic distinction would be like introverts and extroverts, right? Introverted people need more time being alone and more time kind of figuring out what they're feeling, how to feel, what they might need. Extroverts are going to get that same sense of clarity by talking it out with other people. And you're really just going to kind of figure out your own balance. Pay attention to how you feel at the end of a day when you spend more time by yourself versus when you're talking to folks. I tend to be on the more introverted side. So after I do things like this, or after I have a full day of patients, I'm tired at the end of the day, and I know I need to like take some time to recharge. But I'm also not sort of a more fully on the introverted side, in that like during the pandemic, if I'm not seeing people for a long time, I start to get a little like I need to talk to people, and get out there. So again, I think it's about treating these things like experiments and figuring out what works for you, and not being afraid to kind of change that balance over the course of your life. You know, there are going to be different phases of your life where you want more people around, where you want more time for yourself, but trying to kind of carve out whatever space works for you.
Thank you. There's another question in the chat. How do you have any tips or tricks for politely sharing with people that you need time alone without coming off as if you don't appreciate them?
Yeah, I think oftentimes people try to code these messages in a way that ends up being a little confusing for the other person, where you can just say, you know, I really need some time alone. And that can come with a message of appreciation. So, you know, I really value our friendship, but I'm somebody who needs time alone to recharge, to take care of myself. You know, and maybe we can touch base in a couple of days, or can I give you a call in a week? I need a little alone time. Or even, you know, to somebody that you live with, I need half an hour to rebuild my resources. I have young kids. And one of the things that I talk about with them is how many do you have the resources to do what you need to do, and they know, like particularly like Friday nights I put them to bed, and I'll say, you know, Dad's had a long week. I'm low on resources. I'm going to try really hard to be patient with you all, but if you're screaming tonight, I might get a little irritable, and I just want to give you a heads up. And they sort of start to understand that language a bit. And so talking to other folks about, you know, hey, this is about my resources and what I need. This isn't about you, and I really appreciate you. Then the other thing to do is just repeat yourself. That people sort of try to re-explain themselves sometimes, and I think, you know, hey, I appreciate this, I just need some time alone. And if somebody doesn't get it, saying that over and over again.
Okay, thank you. I think we have one more question, time for one more question. The question is, what else can you do to cope with stress and PTSD when you have already tried everything and gotten medical help?
It's a great question, and it's something that I've talked to lots of folks about. Is sort of don't give up. One of the frustrating things about mental health care is that there aren't kind of good guidelines about what helps. One of the hard things, and I say this as a practicing clinical psychologist, when someone walks into my office, I don't have a good guide for what treatment is going to work for this person. So, you know, when I do my interview, I'm kind of making my best guess at what's going to be a match to help the person I'm meeting with. Sometimes that's right, and sometimes it's not, and we need to change directions. Sometimes the person you're working with may not have the skills, and I experience this too, that, hey, I've tried what I can try, let's get you with somebody else. So it's super frustrating, and this is, I acknowledge, a really frustrating answer, but sometimes you have to try lots of different clinicians before you find somebody who's a good fit for you. One of the things we know from the psychotherapy literature is that you have to find a good fit between you and the person you're working with, both in the approach that they use and how you understand yourself and your illness, for it to be helpful. And sometimes that takes a while, and that's a frustrating process. It takes time, it takes money, and it is not easy, especially if you're working through insurance coverage. But I encourage you to stick with it. And if you need to take some breaks from that process, I get it. But please keep trying to reach out. There's lots of different approaches that we know are helpful. I see somebody in the Q&A mentioned EMDR. That's, you know, one of several, you know, helpful approaches to treating trauma. The cognitive processing therapy. There's a great This American Life episode about that. prolonged exposure, psychodynamic treatments. There's lots of helpful pieces, but we don't have good answers about which one you should do or which one you should try. So if something doesn't work for you, try something else. Go to a different clinician. And I will say good therapists are okay with that and know their limits and recognize when you might need to see somebody else.
I'm just going to sneak this question in right before we go. Really good one. Is there a list of psychologists that specialize in chronic illness for each state?
Not that I know of, but if you contact, the two places to contact are your state psychological association or state social work association and your university clinics. I will say that mental health in general and psychology in particular has been late to the chronic illness game in the sense that we haven't had kind of people trained specifically to help folks with chronic illness. That's changing. Oh, NAMI is a good resource. That's great. Thanks for pointing that out. Absolutely. The training, we have a lot more training programs in health psychology and working with health behaviors and integrated care. I think the number of people coming out with good training, the National Alliance for Mental Illness is NAMI, coming out with good training. And in the next 5 years, I think we'll see a lot more resources as that kind of cohort of folks graduate, which again, I know is not like the best answer, but I do think in most states there are some resources, if not lots, and the advent of telehealth should hopefully make that easier to access.
Great, thank you so much. So before we close out, I just want to say a couple of things. One is, I know that there were some questions in the chat that we weren't able to get to. If there are additional topics related to trauma and PTSD, or just topics in general that you would like to see at future HFA educational sessions or at future symposia, if you could add that to your end of the whole symposium survey. There's a question there about that, and it's really useful to us as we start to plan our 2022 sessions and symposium in 2022 in San Antonio. So please definitely put that input in there, or just get in touch with us directly. The other thing I wanted to mention is that there will be an evaluation that pops up at the end of this session. It actually will appear in your web browser, not through Zoom. So if you would like to add your name to the bottom of that, you will get entered into the drawing for the prize of the day. And then lastly, there's additional sessions happening tonight, and you can get to those sessions by going to the HFA Symposium website and just clicking the box that says join here. So please be sure to join us for the remainder of the sessions, which hopefully will also be as wonderful as Dr. Russ's session. And again, thank you so much for sharing your time and experience with us. It was really, really a fantastic presentation, and I can't wait to continue to collaborate with you, and welcome to the bleeding disorder community.
Thanks, I really appreciate it. Thank you all for having me.
Have a good night, everybody.